Greetings, everyone. My name is Dr. Marie-Claire Wangari. I am a general practitioner by training, and today I'll be taking you through adolescent health in Kenya, challenges and opportunities. So our agenda is as follows. We'll have a brief introduction, then a highlight on key health issues facing adolescents in Kenya, followed by health services access, policies and strategies, best practices and innovations, and then finally recommendations. So why does adolescent health matter? Well, adolescents are people aged 10 to 19 years who make up about 24% of Kenya's population. And this is a critical period for their physical, mental, and social development. And investments in adolescents have lifelong returns for health, education, and economy. Key issues affecting adolescents in Kenya include sexual reproductive health, such as early teenage pregnancies, sexually transmitted infections, and unmet needs for contraception. We also have mental health, such as depression, anxiety, and the increased use of substances. We also have substance abuse, such as abuse of tobacco, cat, alcohol, and other emerging drugs of abuse. We also have nutrition, more specifically undernutrition and increasing junk food consumption. And then finally, we have injury and violence, such as road traffic accidents and gender-based violence. So when we look at sexual and reproductive health, we find that teenage pregnancy rate is about 15% according to the Kenya Demographic Health Survey of 2022. And we find that 1 in 6 adolescent girls between the ages of 14 and 19 years become pregnant or is already a mother, resulting in about 260,000 pregnancies annually in Kenya. In 2022, we also found there was a rise in HIV infection, about 7,307, which occurred amongst adolescents and young people aged 15 to 24, and accounting for 41% of all new infections in the country. Furthermore, adolescent girls and young women are particularly vulnerable, accounting for about 78% of new HIV infections as per 2023 estimates. There is also low access to youth-friendly sexual reproductive health services, and also there is the social-cultural angle to it, where we have cultural and religious barriers to comprehensive sexuality education. With regards to mental health, about 1 in 4 adolescents report depressive symptoms, but there is also limited data on the same. Mental health services for adolescents are also scarce and stigmatized. And mainly, the main problems that affect this age group include school pressures, peer pressure, unemployment, and social media impact of impacting the well-being of this particular age group. For health services access, we have limited access to adolescent-friendly health services, and the barriers include stigma, provider attitudes, cost, and confidentiality concerns. We also have rural-urban disparities in access to healthcare, where you find that it's more easier to get these services in an urban setup as compared to the rural setup. Next up, we look at policies and strategies. So we have our Adolescent and Sexual Reproductive Health Policy of 2015, which guides how to engage with this key health group. We also have the Kenya Health Policy 2014-2030, and we also have the National Guidelines for Provision of Adolescent and Youth-Friendly Services in Kenya. Unfortunately, the main gaps in implementing of these policies, it comes in implementation, youth engagement, and sometimes funding. Now, onto the best practices and innovations. Some of the key best practices that work with this particular age group in terms of engaging them for their better health includes having youth advisory councils within the county health system. We also have school-based health programs such as the HPV vaccination. We also have mobile platforms for sexual reproductive health information and mental health information such as NIVI. And we also have community peer educators and safe spaces on the same. So recommendations on how to engage this key age cohort includes strengthening multisectoral collaboration, either through education, health, and youth affairs, because these issues cross-cut various tenets of the health system and the leadership and governance system of the country. We also have scaling up adolescent-friendly services across counties. We also have the support of comprehensive sexuality education in schools. We also have to prioritize mental health in the national health budget, as currently the investment is less than 1% of the country's GDP. And then also we need to leverage on digital tools and social media to reach these adolescents and promote good mental health, mental, physical, and social well-being amongst these particular age groups. So in conclusion, we find that adolescents are the heartbeat of Kenya, and investing in their health is equivalent to investing in the nation's prosperity. And as we say, nothing for us without us. So we need to include these adolescent voices in health decisions. Thank you.